It's all yours.
Thank you, Governor. Secretary Sebelius, Director Collins, distinguished members of Congress, and certainly last but not least, all the board members of Research America. It is truly an honor to have an organization like Research America think so highly of the grand experiment that is CIRM to convey upon us this wonderful honor this evening. CIRM is privileged to do its part to build upon the magnificent work funded by NIH in the ongoing quest to get therapies and cures for any of a number of currently incurable diseases and conditions. You know, last year, Faster Cures sponsored an event, the Celebration of Science, here in Washington, D.C., which I imagine a number of you attended. Among other things, Director Collins and his fine band of doctors rocked the night over at the Kennedy Center. I don't know how many of you were here to see that, Director. That was a fantastic evening. The Celebration of Science was dedicated to highlighting the inexorable march of science in general and biology in particular, and talking about the overwhelming contribution to society that biology has given over the decades. CIRM is the latest in a long line of agencies, institutions, foundations, what have you, that are doing its part to try to further the cause. We were very fortunate, and by the way, would like to acknowledge my predecessor, former Research America awardee and visionary, Bob Klein, who is here, who created CIRM, and Bob, and one of our original board members, Dean Claire Pomeroy from the UC Davis School of Medicine, who unfortunately is leaving us, but is going on to become CEO and president of the Lasker Foundation this June. So Bob and Claire over here. CIRM, very interesting, as was noted, we are currently funding research with some 60-odd institutions and companies engaged in research trying to find therapies or cures for 31 currently incurable diseases and conditions. We go after it using all sorts of stem cell technology, whether it's embryonic, adult, so-called induced pluripotent, and others. Now, some will say, why are you trying to tackle things from all these different angles, particularly when some of the technologies that you use engender controversy, and you could do something some other way? Well, a couple of years ago, you may recall, there were 33 miners stuck in a mine in Chile, and there were 3 tunnels that were bored into the ground in the hopes that at least one would get to that cave in which they were trapped and free them. Ladies and gentlemen, patients suffering from incurable disease are those Chilean miners, and it behooves us to try every avenue we possibly can to try to help them out. And that is what stem cell research is all about and what CIRM is dedicated to. You know, our scientists who are in the middle of great work right now say, well, we're halfway through the funding cycle. What are we going to do when the money runs out? Well, the sustainability issue is something that's very much on my front burner. That's a story for another day. But I would, to invoke Mary Lasker again, like to quote her when she noted, if you think medical research is expensive, try disease. Members of Congress who are here, we out in California implore you to consider doing everything you possibly can for the NIH to continue funding to help us find the cures for these terrible diseases. Not only will that benefit the patients and their families, but if we don't do something, as we all know, spiraling healthcare costs will take this country down in about 4 decades, bankrupt the country. We need to find those cures. Lastly, to the Rogers family, thank you so much. Had a chance to speak to Congressman's widow and daughter, had a very nice conversation, and I want to say how proud I am on behalf of CIRM to be the recipient of this wonderful award. Thank you very much.